So, hello guys, welcome to Medico's Adda. So today we have Dr. Kakha Bregvadze sir with us, a well-known professor at Kakha International University. Also, he is a physician at the dermatology and venerology in Tbilisi, Georgia. So, sir, can you give a short introduction to our viewers?
Yeah, nice to meet you. My name is Kakha Bregvadze. I'm part of the Caucasus International University. I conduct practical skills in internal medicine and microbiology. I also teach at Tbilisi State Medical University at the Department of Molecular and Medical Genetics. And I'm involved in clinical practice, practicing in dermatology and venerology, sexually transmitted disorders.
Yes, sir. So next question we have, sir. You have been teaching MD medicine program for a long time to international students. So how is your experience with them?
Yes. So when I started teaching, it was a whole new experience for me. Work with international students. I was stunned with the motivation and like willingness to participate in all activities and to master the topics, various topics. So I think that most of the students, 99% of students, are well motivated, and I'm pretty sure that their motivation will be fruitful in their future career and life.
Yes, sir. So next question is, what would you like to tell about education pattern in Georgia?
Yes.
Because some many of students which is came from India or international students, like they have confusions between patterns of Georgia. Like, so what do you tell?
Yes. So MD program in Georgia, like undergraduate program, lasts 6 years. And during the 6 years, we have like the basic subjects, preclinical subjects, then rotations at hospitals. So this system resembles the most of the systems found in Europe, like the neighboring countries, Russia, Ukraine, Armenia also have the same education pattern to say.
So we can say that in Georgia we can give like European pattern studies or
Yes.
US pattern studies to Indian students or international students.
Yeah, you can be sure that it's like follows the like International Medical Education Society's recommendations.
Yes, sir. Our next question is like this pattern which is give to students in Georgia,
Yes.
which is capable, which students can capable for like USMLE exam or PLAB exam with these studies.
Yes. So we have various activities for students. Mostly it's the questions which are distributed in various categories, to say levels. And level 2 and level 3 questions are the USMLE and PLAB type questions. Also in internal medicine, for example, we do some like the case scenarios and patient simulations, which is also part of the USMLE and PLAB exam. So I think if student is involved in all of this activity and they revise the material regularly and practice the topic regularly, they directly prepare for those kind of the exams. And also the syllabus and the curriculum corresponds to the aims and scopes of the exams you mentioned.
So it means students can crack a USMLE or PLAB exam with this pattern. Like
Yes, if they follow the pattern given in syllabuses and practice those material, including the clinical skills which they are introduced, they are directly preparing for the those type of the exams, to say.
Yes. Now our next question is like some Indian students, like India is a big country.
Yeah, it's a big
so India
country.
have also big exposure of patients also. So some Indian students and their parents asking to us, like we are students in Georgia, like how is the practice, like how is the practical knowledge?
Exactly. So as I mentioned, the education pattern after the basic subjects, there comes the preclinical subjects and rotations. During rotations, students as a small group visit hospitals where they can observe under the guidance of the attending physician, observe the patients, participate in the procedures, and there are university has contact with the largest hospitals found in the country with multi-department clinics. So you, if you can even participate in your free time as a volunteer and get all kind of the practice there. So it really depends how active the student is. But the rotations and the bedside teaching, that's very important thing, is important part of the medical education in Georgia.
In Georgia, so
Yes.
So students like don't worry about that. We cannot give like practical knowledge or about that. So
There is a thing related to the pandemic which created
yes.
a little bit of chaos,
Yes.
but it's now improving, so all students still have contact, like they renewed the contact with
Yes, of course,
students.
sir. Georgia is a very nice country for MBBS because in India it's very expensive for like MBBS study. So it's very nice country to come here and do your MBBS
Yes,
studies.
I think there is a important thing is that there is a safe environment to say.
One of the safest country for girls also.
Yes,
we can say that.
economic instability is not that much to say. Criminal is low. Knowledge of the English is, I think, sufficient or can be improved in general
we have
population.
nice experience about
Yes, but mostly it's like, of course, you should ask for other Indian students for the personal experiences. But I just asked your group mates, and they told me that then they go back to the India, then they like want to come soon back to Georgia. So it really depends.
Yeah. So last question, sir. What do you like? Will you give any small message for who wants to come in Georgia for studies and our viewers?
Yes. The first thing and the most important one is your motivation. If you are motivated to study the medicine, you have all opportunities and possibilities here in Georgia to master the medicine, including the basic subjects and clinical training, bedside teaching.
Yeah. Thank you so much for your timing.
Thank you.
And also, we want to know your achievements. We see that in your Facebook page, you have you get a clinical management awards from European studies. So, what do you say about that?
Yes, so those, like when you are active in the clinical practice and also in the educational area, you got like various contributions. So I have received many awards related to my major specialty in dermatology and venerology, but I also held some awards in medical education. So that's why I always try to introduce like all the new concepts and all the methods for teaching medicine.
Yeah, this can motivate to students.
Yes.
Do not stop studying after your degree, after your bachelor's degree. Keep studying and keep motivated.
Yeah,
Yeah.
I agree.
Yeah. So thank you so much, sir, for giving me time.
Thank you.
Thank you.